Welcome, and thank you so much for taking the time to be with us today. We're very excited to present our 9th annual Voice of the Medicare Consumer Survey Results, having surveyed nearly 20,000 healthcare and Medicare consumers to date regarding their shopping and enrollment behaviors. We use this data to help with our development activities and provide our healthcare audiences with insights to better connect you to your end users. We're also thrilled to present some interesting findings from our first annual Voice of the Agent survey in partnership with AgencyBloc. We uncovered what matters to agents today, tools they are using and not using, and barriers to their own success, among others. We also have a special guest presenter, a sales expert with one of our multi-carrier partners who will share firsthand experiences with our PlanCompare One platform. And please hang in there until the end for a special announcement about our new, exciting digital solution. I'm Cara Tarantino, Director of Marketing, and it's my pleasure to introduce our presenters today, Amanda Woodman, Sales Executive focused on the ConnectureDRX Health Plan segment, and Jason Smitgens, Account Executive on our multi-carrier team. Our two guest presenters today are Steve Ogden, Sales Manager with AgencyBloc, and Kevin Peterson, Sales Executive with our customer Connexion Insurance Solutions. In 2019, we introduced the term digital Medicare as a means of proactively responding to a changing world. Nothing could be truer today. Even with the progress we made in the past year with connecting seniors digitally and getting agents on board with electronic platforms, there's still much work to be done. Paper enrollments have not gone away, and there are still many carriers lacking the right extensive network to help them find new avenues to increase Medicare enrollments, along with other opportunities to improve the member experience. Today, we will talk about how the senior in 2021 is fearing less and demanding more than the senior in 2020 who was thrown feet first into a pandemic. Amanda will take us through the Voice of the Consumer Survey Results. Jason and Steve will share insights from our agency survey, and Kevin will share powerful firsthand broker experiences with digital transformation. Please type your questions into the Q&A box. We'll be sure to follow up on any questions after the webinar. I'm going to turn things over now to Amanda to get us started.
Thanks, Cara. So a few words about ConnectureDRX to get us started. We've been around since 2000. Many of you might remember us better as DestinationRx. In 2013, DestinationRx was acquired by Connecture to add Medicare and drug transparency to our overall product suite. And today we go by ConnectureDRX. As the software company, we provide both SaaS and API solutions to health plans, multi-carrier organizations, agencies, and pharmacy benefit managers, all with the goal of pairing beneficiaries with their best fit Medicare plans. Our experience and expertise with therapeutic interchange, drug comparison technology, and analytics also allows health plans and others to improve the customer experience by connecting members to low-cost drug options proven to increase medication adherence and elevate star ratings. We have the largest distribution network in the industry, one that offers an easy way to connect health plan products to agents and agents to the products they sell. And our proven retention strategies enable our customers to create personalized messaging that leads to brand loyalty as members undergo potential changes in their coverage. And we pride ourselves on being the gold standard in the industry for drug pricing, as many of you rely on us for pricing expertise. We leverage plan data directly from our carriers and always source prices at the pharmacy level, updating our pricing data every 2 weeks and never using regional averages. Things have already changed for seniors this year, so let's take a brief look at the differences between the senior of 2020 and the 2021 senior that's emerging today. 2020 was arguably one of the most difficult years in recent history, derailing hopes, reducing optimism, and changing the daily routines so many people have come to rely upon. It has been especially tough for those 65 and over who accounted for 80% of COVID-19 deaths in the US. The senior in 2020 felt fear and uncertainty. They faced physical and emotional struggles, isolation, and boredom. Their in-person world was stripped away and their digital presence emerged, along with the need for social connection and to get the business of living done. Those who were employed were not able to see a clear path to retirement, and that's only assuming they were able to keep their jobs. Retirement funds dwindled and their view of retirement certainly changed. The seniors' ability to connect digitally to better understand their Medicare plan options became critical. They had many questions and reached out via their phones and online for answers, and they were desperate to trust in the information that they received. The new year brought welcome changes for the senior, though. So the senior of 2021 is feeling more in control. The vaccine comes with hopes of getting out more and reestablishing in-person connections. Seniors will continue using telemedicine even after the pandemic is over. They believe prescription drug prices are too high and demand to see prices before they pick up their prescriptions. They want lower cost options they can speak to their prescribers about. Compared to 2020, seniors will find it less difficult to get the right information to support their Medicare plan selections. They are more likely to change plans as AEP, attracted to a wide variety of supplemental benefits offered by MA plans. And as the consumer experience rises to a frenzy across all industries, the consumer is indeed driving the bus and starting to feel the positive impact. So as you know, every year we survey several thousand Medicare consumers about their shopping and enrollment behaviors immediately following AEP in mid-December. So let's first take a look at who responded to the survey. 66% were women, 34% were men. There was an equal distribution among ages 65, 66, and 67 and over. 10% of responses came from those aged 62 to 64 to understand their feelings about Medicare leading up to their age and year. 74% are retired and 25% still work in some capacity. Most are in very good and good health. Only 6% reported being in poor health, and the majority, 64%, are on Medicare only. Fewer than 20% are on an employer plan, and 10% are on other individual health plans, such as a health exchange plan. We've been seeing the same trends that the Medicare industry as a whole has been experiencing with the increasing popularity of Medicare Advantage plans. In fact, in a Fierce Healthcare article released just yesterday, MA plan holders spend $1,640 less a year compared with traditional fee-for-service. This means more financial security and peace of mind for beneficiaries, especially those on MA plans, are more likely to be dual eligible and enrolled in Medicaid. In our survey, we saw a 7% increase in MA enrollments in the past year. And of note, during ConnectureDRX's own AEP 2021, we had a 33% increase in MA enrollments over the prior AEP. Among our responders, enrollment in Original Medicare and Part D decreased. MedSup enrollments decreased slightly as beneficiaries switched to popular MA plans with more attractive benefits. So this brings us to beneficiary behavior. We asked consumers from which carriers they purchased their health plans from and why. UnitedHealthcare was the front runner with 24% purchasing their plan, followed by 18% who purchased a Blue Cross Blue Shield plan, 13% an Aetna plan, and then 11% Humana. These are the jumbo health plans that we all recognize, but I also like to point out that 16% of seniors chose the other category. This indicates that they were selecting regional health plans offering competitive benefits, which have an increasing presence in our network each year. We also dove down a little deeper to look at selections based on whether they already had Medicare or were new to Medicare. For those already on Medicare, 61% stayed with the same carrier they had in the previous year, and only 14% changed carriers. Some beneficiaries may have been hesitant to change plans due to the uncertainty surrounding the impact of COVID-19 on their coverage. 19% of beneficiaries purchased a Medicare plan for the first time. And of this aging group, nearly half went with the carrier that they had under an employer or individual plan. So having strategies in place to create a seamless transition from under 65 to Medicare is crucial, and then nurturing their first year Medicare experience even more so. At ConnectureDRX, we know the importance of this and provide insights to health plans with potentially at-risk members, whether they are aging in a Medicare, transitioning from an employer plan, or impacted by a plan discontinuation, among other circumstances. So why did most beneficiaries stay with their same carrier? And I think the simple answer is trust. The majority of beneficiaries, 68%, trust their health plan brand and have been happy with them. As we've mentioned, many adopted a wait-and-see attitude that could lead to a great deal of more plan changes this AEP. Followed at a distant second were 9% of beneficiaries who found the right plan only after shopping around. Broker guidance was up slightly as the reason beneficiaries stayed with their plans in 2020. There was a small decrease in beneficiaries staying with their plan because their doctors were on the plan. As health plans offer more variety of benefits, they're finding it easier to retain members and keep switching within their own brand. So now let's get into the details of switching behavior. What may surprise you is the less expensive plan was not the top reason for switching. Consumers have shifted their view of how many benefits they need and are looking for an a la carte experience. There was a 9% increase in switching for more supplemental benefits. And the top supplemental benefit that beneficiaries switched plans for is dental, holding the top spot for 2 years in a row, as also uncovered by Deft research in their 2021 shopping and switching study. Because of rich benefits, we see that beneficiaries are actually happier with their plans today, which is an 11% change over the previous year. Those who switched plans because their broker guided them to a better fit plan was up as well. We continue to see a strong influence of broker and agent guidance over the past year. When brokers can easily show the value of a better fit plan, consumers will be open to the change. Some seniors switch plans to follow their doctors. Most seniors, more than 3/4 of them in fact, said they would not consider changing doctors to save money on a plan. And Deft research also found that beneficiaries with COVID-19 were more likely to switch plans within the same carrier than those who did not get COVID-19. So when consumers made the switch, how exactly did they do it? With the advent of COVID-19 and the switch to more digital engagement, beneficiaries took to their computers, phones, and tablets to learn about Medicare. Outreach via phone and online outlets to compare plans was up across the board. There was a 4% increase in beneficiaries who called an insurance broker to help them compare plans and brands, followed by a 3% increase in those who went to the Medicare.gov website to compare plans, and a slight increase in those who went directly to a carrier website. Making plan information available through multiple channels is the first step in the right direction, but making it interconnected is the key to conversion. So let's take a look at this element of interconnectedness. 43% of seniors research plans online, but they also rely on their brokers to clarify the information they see regarding Medicare. Our survey revealed a whopping 15% increase over the previous year in those who started searching online and then called a broker or agent to help them better understand those plan options. Even though seniors are increasingly becoming more digital, some remain confused by what they read online and still looked to direct mail and other offline information. While the digital transformation is real, we also know that a multi-touch approach is necessary to reach every kind of senior. Of interest also is Deft research found that 50% of beneficiaries prefer to attend Medicare seminars in person. And as both in-person and virtual seminar attendance decreased in 2020, beneficiaries came to rely more on direct mail to get their information. I'd also like to add as a side note, when we talk about interconnectedness, the importance of omni-channel interaction as the primary way B2B organizations are working today. Even as in-person is still an option, consumers are making it clear they prefer a balanced mix of engagement: in-person, remote, digital self-service. Omni-channel was an imperative during the pandemic, and its importance is growing still. It's one of the reasons we focus heavily on this type of interconnectedness between our consumer, broker, and call center channels on our PlanCompare One platform. In fact, while many businesses should be able to fully connect in person by 2022, according to a recent McKinsey article, only 15% expect in-person to be the norm. So we always talk about the best fit plan, but what do seniors really consider to be their best fit? Beneficiaries said their best fit plan was one with the following: lowest out-of-pocket costs. So there was a 14% increase in those who indicated their best fit plan was the one with the lowest out-of-pocket. Each year, more and more of the population understands there are many factors to cost, not just premium. One of these factors is drugs. Defining a plan with the lowest drug cost was up 5% since the previous year, with the importance of a zero premium plan dropping by 2%. Second is plans with the best supplemental benefit options, with a 9% jump since the previous year. And third, broker guidance. 23% chose a plan that their broker guided them to versus only 17% who selected this reason in 2019. Drug pricing transparency and the ability for consumers to get lower cost alternatives is more important than ever. Drug makers increased prices in January and July. And since the beginning of the year, there have been over 800 drugs with price increases by an average of 4.6%. Even with manufacturer discounts and negotiated rates by insurance companies, the increased list price does impact consumers. And of course, most consumers don't even realize drug prices have increased due to high deductibles and out-of-pocket costs. And many times doctors don't know these costs either. So what we found in our survey is that 53% of seniors now compare drugs and drug prices online, which is up 3% since 2019. And the number of seniors searching online to compare drugs, prices, and seek medication alternatives is increasing on carrier sites. And in 2019 and 2020, it makes sense that fewer people went in person to ask a pharmacist. As drug pricing transparency and the member experience become more important to star ratings, it is the perfect opportunity for health plans to engage members directly by using member data to proactively reach out with lower cost alternatives. We offer this through our database RX therapeutic interchange solution. When it comes time for CAP surveys, members will remember it was their health plan who helped them save money. Lower cost alternatives help improve medication adherence and are ultimately reflected in star ratings. This tool works in tandem with our consumer self-service option, DrugCompare, where a member can look up drug prices and options on the health plan website year-round and then ask their prescriber about the options they find. To conclude this portion, I am going to give you some insight into consumer perceptions. Consumers were asked the question, do you trust Medicare? And this included private carriers, the .gov sites, brokers and agents, and the Medicare system overall. And the data shows that trust has risen across the board for all of these groups after notable swings since 2018. Since then, trust in private carriers has risen 10%. And when it comes to Medicare.gov, only 23% trusted these sites in 2018, but that increased to 55% in 2019 and then 60% in 2020. It's comforting to know that considering the challenges of the last year, especially for beneficiaries, their ability to trust and depend on our Medicare system has gone up. It may indicate that they are receiving the guidance they seek and the coverage they expect from their health plans. The other issue at play is beneficiaries are becoming more adept at using personal technology and using self-service to shop and enroll. With this comes increased confidence in their ability to select the right plans and coverage for their own needs. Before passing the torch to Jason, I'd like to mention that you can download the full consumer survey white paper on our website, and we will also include the link in our post-webinar email. Over to you, Jason.
Thanks, Amanda. We're going to switch gears now and talk about agents. I thought you might find it interesting to hear what leaders in the insurance industry have learned in the past year. To state the obvious, insurance executives have recognized there is a significant need to transform digitally. According to Deloitte, 48% of insurance executives said the pandemic showed just how unprepared the insurance industry was to weather the storm. Only 25% said their carrier had a clear vision and action plan. What they did learn was the need to take advantage of data-driven insurance and management systems and marketing automation so agents can learn more about customers and make it easier to build relationships. And since customers expect a more personalized experience, insurance products are becoming more flexible. Automation and machine learning are key. Today, there are so many aspects of insurance that can be automated, such as using Hootsuite to manage social media posts so agents can spend more time pursuing prospects and leads. So, to dive a little deeper into what agents have learned in the past year, I'd like to introduce one of our valued customers, Kevin Peterson, sales executive with Connexion Insurance. I'm going to let Kevin provide a little bit of background on himself, and then he'll share his experiences using the ConnectureDRX PlanCompare One platform. Kevin?
Thanks, Jason, and thanks for the opportunity to talk to you guys about how the Connecture platform has been so valuable for our agency over the past couple of years. most notably this last year with the COVID pandemic. Just to give you a little bit of background about myself and my firm, Connexion Insurance is a general agency. We're a multi-carrier agency here in the Pacific Northwest, serving a number of states in our markets. I've been in the Medicare business since 2008, and myself and my team assist several thousand Medicare clients with their initial plan research, plan comparisons, and also provide year-round support and annual reviews during the annual election period every year. I'm a passionate advocate for Medicare beneficiaries. I think Medicare brokers are a very, very valuable resource to help people kind of navigate through all the clutter with Medicare, and our team really prides ourselves on doing that. And I have been a avid user of Connecture over the last 4 years that our firm has onboarded this platform. Like many agents, I can be very opposed to change. You get used to doing business one way, and here's another system that comes in. But once I started using the Connecture platform, and my team did, not only from a sales perspective, but from an administration standpoint for our operations team at the office, the tool has become extremely valuable, especially over the last 12 months. And some other brokers that I work with that are still doing business the old way, papers or PDF applications, when COVID had hit and reaching customers face-to-face was a challenge, we really were not interrupted by any means, largely in part due to the value that the Connecture platform offers. I'm going to talk to you guys a little bit about how we've utilized this software, this platform for helping our agency become much more successful and efficient. So go ahead with the next slide, please. So one of the big features that we've experienced with Connecture is increasing our self-service enrollments. Now that we are kind of in a new way of doing business, a lot of brokers are working remotely, going over email and telephone communications with their clients. Connecture has been just hugely successful in this. And it's great for telework because it can be accessed from anywhere. We're able to send plan comparisons to clients. They're able to view those comparisons and benefits 24/7 and actually complete an enrollment without our assistance. It's reduced call handling times. So when I work with a member and identify a plan that's going to be a good fit for them, I can preload all their member data on the insurance application, send it over to them for signature, and they hit submit, and the application is done. We don't have to go back and forth about which election period to add or making sure that the Medicare number is the right number. Clients really don't see the enrollment process every day like a broker does. So we're able to kind of get all of the hard work done for them and allow them just to go in, review it, and complete an application. So it really increases our efficiency. And again, making enrollment opportunities available 24/7. Connecture can be used in a multitude of ways. We can do a full benefit analysis where we set up a profile. I'll talk about that in a little bit more detail here in just a minute. Go through all the plans, send them the quotes, allow them to enroll. But other clients, especially these days, sometimes want to navigate their plan options by themselves. And Connecture has kind of a more external, less personalized method as well by them clicking our broker link, having access to the tool, doing their own navigation, and enrolling themselves on a plan that they see fit. Meanwhile, the broker still gets credit and credited with the enrollment, notified when the enrollment goes in, and then allows us to service that policy from an ongoing basis as well. Next slide, please. So I want to talk a little bit more about kind of the value of Connecture and how it makes not only the initial sale easier, but when we do an annual review of a client's policy to see if a change is needed, it's most valuable there. So when we normally use this Connecture tool and we work with a new client, we go into the Connecture system when we set up a profile. And no, it's not a very laborious task. It's name, date of birth, and it takes you instantly into the scope of appointment process. So that can go to your client via text message, email, or paper if you prefer. But the text feature is actually very, very efficient. Many clients aren't on a computer when they're sitting down to talk to you about Medicare plans, but almost all seniors now have cell phones. The text comes through immediately. They're able to check the scope of appointment boxes, sign, date, and initial it, and you get a confirmation immediately back that that has been completed, where you can then proceed with the Medicare consultation if the client wants to do that. The other nice feature about the profile setup is the medicine cabinet. I think this is where I have had probably the most success on saving my time during AEP every year. For those brokers that are on the phone, I know when you're an AEP and you're very busy and you know, time is of the essence, the last thing you want to have is a client you've had for 6 years call you with her list of 32 medications and have to start entering those one by one. When you set up a profile in Connecture and you do that medication list on the initial time you take on that client, that data is saved in their profile every year. So when we do a review during the annual election period, we'll review those medications that we have on file. If any small tweaks need to be made, you know, taking a medication off or adding a new one, we do that. But it saves a massive amount of time to have that information already loaded in their profile. And it makes you as the broker look much more professional as well, that you have all this data in one centralized area to communicate that back to your client. And then again, normally in the way that I do business and my team does business, I hate telling clients what to do. I give them recommendations, and that's where I want to send them a couple of plans. And the way that the Connecture platform is built, once I kind of assess their needs and their medication coverage and what they want out of a health plan, I'll send them a couple of different options. And the Connecture platform will allow you to send up to 3 plans side by side, benefit line for benefit line. Very easy to read. It comes to the client in an email. And again, they can then narrow down which plan is going to make more sense to them. And then for the administrative side of it, in historical years, I've been with my firm for about 13, 14 years now. We used to do paper enrollments. And that means that we had people on the operations side that were getting stacks and stacks of applications. They were having to scrub them, correct errors, reach out to our brokers to figure out, you know, what the correct method was if there was a mistake. And then they had to fax, sometimes mail overnight applications, email applications in, and it was a very costly administration expense just to handle all those paper applications. The Connecture platform handles all that for us. The system does not allow you to make a mistake. All the boxes and required fields are in there. The applications are instantly submitted to the carrier automatically in a data feed overnight. And that also leads to faster policy approvals, which again makes your clients much more satisfied that the insurance was issued as fast as possible. And from a broker and an agency standpoint, having the approvals and the commissions roll in from those sales as quickly as possible is also beneficial. And then the last thing I want to kind of touch on is how I didn't really know I could use the Connecture tool this way when I first started working with it, but it ended up being one of the biggest time savers that I have experienced with the tool. Is certain market dynamics might require you to move a large block of clients on a particular plan. And whether that's a county exit for a Medicare Advantage plan, or a significant provider group leaves a network where you've got to move a large number of clients to a different plan to maintain their doctors, or the example I'll provide here is a particular prescription drug company in our market a couple of years ago went from like $12 a month. It's a kind of a low needs plan. And they raised the premium on everybody up to almost $60 a month the following day. And when we ran our reports right before AEP had began, we identified that we'd had close to 400 people on this Part D plan. And you know, for brokers, Part Ds are something you got to do in many cases, and it's really not fun work or you know, financially rewarding. But what we were able to do with the Connecture platform was identify this block of clients that were going to be affected negatively by this change. We sent all of them an email with a little description about what was going on, the reason for them to make a change, and then we provided a step-by-step directions on open our Connecture link. You can put your medications in the tool, and we would recommend you moving to a lower cost drug plan. And over the next 2 to 3 weeks, we were getting dozens and dozens of enrollment confirmations daily from our clients that were saying, thank you for letting me know of this change. I did not know my rates were going to almost go up over 500%. and they were able to self-serve and find a new drug plan for them that was lower cost without us having to spend so much valuable time during AEP moving this entire block of Part D clients. So again, it's just extremely valuable on allowing us to be efficient, but still serving our customer base with really high quality service. Next slide. So here's kind of a link of what we put on our website, and again, with the Connecture link, you can use this however you see fit. But with our landing page on our website, clients can either schedule a consultation, and that goes through an appointment program that we have, or if they just want to browse plans and enroll themselves, they simply click on Shop for 2021 Plans. They can do the side-by-side comparisons, they can do the medication lookups, the pharmacy networks, and all of that, and actually enroll themselves. And the other thing too, and I think this will speak to a lot of the brokers that are on the line, selling business electronically with online enrollments is obviously something, if you're not there yet, you're going to need to get there. And one of the biggest complaints I have had, and most brokers have had, is, okay, I've got all these different carriers that I sell, and let's say there's 15 carriers that I work with. I have 15 different ways to do an online application with all these different insurance companies. There's different logins, there's different systems, and it's hard to remember and navigate all those things. When you've got a Connecture platform where all of those carriers are on one enrollment tool, all the data is under one enrollment tool and one login, and all the applications go in virtually identically, it really eliminates the need to be training yourself and spending that time on learning all these different enrollment platforms, because it can be on one consistent platform for all the different carriers. So again, absolutely thrilled with the way that it has helped our office become more efficient and more successful in sales distribution. Next slide, please. So I'll just close out here. You know, Connecture and the enrollment software that we have has really just allowed us to work virtually and fulfill our mission of helping people find the right Medicare programs. And I can't stress enough how invaluable it's been during COVID, where everyone kind of had to turn on a dime. So hopefully you found that there's some valuable aspects for the broker model. And with that, I will turn that back over to Jason to continue with the presentation.
Awesome. Thanks, Kevin. That's some really great stuff. We really appreciate you being here with us today to share your experiences. So we were very excited to have had the opportunity to partner with AgencyBloc this year to survey agents, with each of our respective companies posing questions to agents about some of our own areas of expertise: Medicare shopping, quoting, and enrollment for ConnectureDRX, and sales automation and CRM integration for AgencyBloc. To briefly show the agent demographics, most were over the age of 51, with 31% of agents aged between 31 and 50, and a small percentage under the age of 30. Although fewer younger agents answered our survey, we are seeing younger and younger agents entering the Medicare space and engaging the agent consumer through our direct-to-consumer site on our PlanCompare One platform. Most agents surveyed are part of an agency, and about half are in agencies with less than 10 agents. 73% of respondents indicated that they're downline from at least one FMO. As most agents, about 64%, sell across state lines on a regional or national basis, it's important they have the right shopping, quoting, and enrollment platform to effectively serve the senior population. When agents and seniors can't meet in person, they need alternative ways to communicate. The importance of building relationships with seniors is paramount to any insurance agent, and that includes the ability to communicate with them in the way they want to be communicated with, whether that be phone, email, or text. We learned during our own AEP 2021 that 83% of beneficiaries and brokers still preferred using the desktop over other devices. This was up 3% over the previous AEP. 13% used mobile devices, and only 4% used a tablet to enroll. We found in our survey that 53% of respondents said they are downline from 2 or more FMOs. This presents a number of challenges for agents. Multiple uplines means multiple enrollment platforms, which may vary drastically from one to another. Agents have to manage multiple logins and passwords, as Kevin mentioned before, for each of those different enrollment platforms. Agents might not be able to see all plans or the plans they are licensed to sell in one place. And they cannot effectively manage their book of business in one place either. So they can't see the carriers in the same place where they run quotes, do plan comparisons, enter drugs, and more. So in spite of the pandemic, 50% of agents surveyed indicated that they met in person with a beneficiary this year. Because of staying with old behaviors, many of these agents may have been reticent to switch to more digital engagement and adopt new technologies. 66% of agents are using carrier-specific enrollment platforms. This means they're going to different platforms to enroll based on the health plan. This is an inefficient use of time and makes it more difficult for agents to manage their book of business, which is definitely one of the biggest frustrations that agents have. 23% indicated that they don't have any electronic platform at all and will find themselves playing catch up this year if they don't. 15% of agents are still doing at least half of their enrollments on paper. These challenges, however, are exactly why we are here. As Kevin so eloquently presented, these are the things that we are able to solve for through our technology. The time for digital transformation is now. Seniors are definitely getting on board, and so should agents. And now at last, I'd like to turn the presentation over to Steve Ogden, Sales Manager for AgencyBloc, to present his survey findings. Steve?
Thank you, Jason. My name is Steve Ogden. I'm the Sales Manager with AgencyBloc. AgencyBloc has been around since 2008. That's when AgencyBloc launched. But we've actually been doing this survey for a while now, too, since 2017. Next slide, please. So what we ask our health and life agencies are how they're managing their book of business currently. And actually, the results have been pretty consistent with this graph each year. One thing I want to point out on the graph is the other up at the top in the dark blue. What we found out is other to most agencies meant either a generic CRM or an industry standard agency management system, but they just put the names of those systems in other. So pretty much takes that category out. It's generally a CRM or an AMS. So we know that too many agencies, like Jason just mentioned, are relying on things that are not nearly as automated as they should be, or generic ways to manage their business through CRMs, generic CRMs or spreadsheets. And we think there might even be some confusion on the definition of CRM versus an AMS, and we'll talk about that a little bit. So we can talk about the difference, but I think the most important thing is that once agencies switch from a generic system to an industry-specific system, they have more time savings, resource savings, efficiencies increase, they're better organized, and other things that are more efficient in that switch. Next slide, please. So we asked the agencies, how long have you been using your current CRM or AMS? And again, most agencies have been using their current solution for 1 to 7 years. You can see the difference there in the graph. What I find was interesting, though, that plus 7 years, that has actually decreased in the last 2 years. And so it seems like the agencies are starting to take a look and switching out if the solution is not meeting their needs. Next slide, please. So let's talk about agent productivity. And this is very, very important because we saw that the agencies using spreadsheets and generic CRMs the most, they're using them the most, but they're not benefiting them the most. So we found that the people using the agency management systems are circling a lot portion of added productivity, but the generics are circling a little. So even though they're using them, they're not getting much productivity out of those systems. Next slide, please. Not surprisingly, out of these choices, agencies value ease of use more than anything else that the system offers. What is a little bit surprising to us is that integration capabilities has moved up second in reasons that the agencies use their systems. And we would have not thought that, but there is a good reason. With people doing best of breed products, it is good for AMSs to reach out to people like Connecture and other platforms, so there'll be efficiencies in how they collect their data. Next slide, please. So let's just at a very high level point out the difference between a customer relationship manager and an agency management system. You can see that an agency management system is very industry specific, and the customer relationship management system can be used in any vertical. You could be a manufacturer, teacher, anything using a CRM. And these are only 4 of the differences. There are many more differences when it comes to running your insurance agency and what you need to be more efficient. Next slide, please. So here's what we know, that when agencies do switch to industry-specific solutions, they find it much easier to use, that ease of use that we talked about in the slide before, and productivity increases. So very, very important, not just what they're using, but the results of what they're using. Next slide, please. So without a commissions management system in place, it's nearly impossible to identify missed or inaccurate commissions from carriers, at least in a large way. If you're doing a lot of business or using multiple carriers, commission statements are very, very hard to work with unless you're using a system that has that commissions platform on it. And since we know that agencies are still using spreadsheets or generic CRMs, it's not surprising to us that they're struggling to find missing commissions. 47% said they'd be able to find and identify those missed commissions with the right technology. And we're talking about a couple things here. We're talking about missed commissions, but we're also talking about actual versus projection. If you contract for the carrier, are they paying you the right amount of money? Next slide, please. And so the right technology basically is an industry-specific agency management system with commissions capabilities. With your carriers and policies and commissions in one place, all it takes is running that commission report to find those missed or inaccurate commissions. So tracking missed commissions can definitely be done and can definitely be effective. Next slide, please. So these are 2 of those reports to identify the misses. And by seeing if you were paid at all is one way. I mean, did I get the commission I was expected to get? And the other piece of the puzzle is, did I get paid in the amount I expected to get paid? So those are the 2 ways that people will pick up thousands of dollars through technology just by tracking those misses or misprojections. Next slide, please. So the other thing we talk about is switching to automation. And we found that more and more agencies are moving to automation. since we've been doing this survey. So they're getting more experience with automation tools. And while most are still new to it, more and more are showing up in that 3 to 7 year category or the 7+ year category each year that we do this survey. Next slide, please. So let's talk a little bit about the purposes of the automation tools. This question happens to be multi-select, so I could select as many reasons as I want. And you can see from the presentation that most of the people are using prospect follow-up in their automation tools. But that just barely out classes like communication or lead generation. So they're really using automated workflow throughout the agency to get this general workflow efficiency. Next slide, please. So without automation, agencies are able to turn manual, inefficient, many times inconsistent tasks into repeatable, efficient, consistent ones with automation. Automation helps agencies ensure that the touch points throughout the agency happen and that everyone internally in that agency is on the same page. So important moving forward to have workflow automation in that technology. Amanda, I'm going to turn it over to you.
Thank you, Steve. Okay, so I'm going to wrap up with 2 new solutions that we are sure are going to have an impact this year. The first one being PlanSmart, which is our predictive analytics tool that identifies at-risk members who may be negatively impacted by changes in their plan. These changes could be the result of a change in health, a formulary change, maybe a new plan is coming into the market, or a plan might even be sunset. By leveraging the best fit plan analytics, health plans can create consumer-focused campaigns using the ConnectureDRX provided reports. These reports focus on member migration. So for example, from MedSup to MA, we look at where disenrollment may occur, or identify members on commercial plans who are transitioning to Medicare to get them on board with their best plan options in advance. And you can bring this data to life and make it actionable through our retention suite. It's a highly personalized enrollment tool for existing members. So I always welcome the opportunity to share more with you in a one-on-one demo if you're interested. And to Jason.
Thanks, Amanda. We are thrilled to announce ConnectureDRX's Medicare Edge, available for smaller to mid-sized agencies for Medicare shopping, quoting, and enrollment, all on one site with access to all carriers selling Medicare and MedSup. Medicare Edge will help these agencies acquire new business, eliminate paper enrollments, and retain their customer base, and we'll be able to get them up and running quickly. Also, as a technology partner, we want to ensure smaller agencies have one place to quote and enroll plans while maintaining their existing relationships with larger insurance organizations. Medicare Edge will be ready in time for AEP 2022 with most of the exceptional features and functionality of our PlanCompare One platform. Look for more information coming your way soon about Medicare Edge. Kara, back to you to wrap things up.
Thanks, Jason, and thanks to each of our presenters today. And we also thank you for joining us today. Since we had 4 presenters, please feel free to reach out directly to any or all of them via email with your questions. If you have questions that you feel everyone can benefit from, please send them to marketing@connecture.com because we'd really like to share the information with everyone. We'll be following up with you in the next couple of days with the webinar recording, a link to the white paper download on our complete consumer survey results, along with a link to an announcement about our new Medicare Edge digital technology. So again, thank you so much for attending, and we look forward to seeing you on another future webinar. Thank you. Bye.